Okay, these are the soft tissue structures for the foot. Okay, so notice how I've separated out the foot and ankle. What we are looking at then are some soft tissue structures that basically go from the toes almost up to the ankle. And the first ones I want to talk about are the tendons on the top of the foot. Okay, so if you look closely at Kelsey's foot, you can see some nice veins, and then they're standing out pretty well. If I ask Kelsey to bring her toe up like this, so hold your toe up like that. Good, hold it in that position. And I try pulling down, okay? Now, and you may not be able to see this on the camera, but I can certainly palpate it and feel how taut, how tight this tendon is right here. So this is extensor hallucis, big toe, extensor hallucis longus. And the tendon is pretty easy to feel across the top of the foot and really across the ankle joint right here. So that's one of our structures, extensor hallucis longus tendon. Now I expect you to do exactly what I'm doing right now. So when you want to know where a muscle or tendon is in the body, the best thing to do is ask the patient to contract that muscle. So now I'd like you to bring all of your toes up. Okay, I'm going to pull these down. And as I'm pulling down, okay, again, hers don't stick out as well as some people's will, but you can see that one pretty well. There are 4 tendons right here of extensor digitorum. Okay, the extensor digitorum tendons are crossing the ankle right here. I can see them standing out very well. Okay, now another thing, and this is not on your palpation list, but I think it's pretty cool, is that I can see really clearly where the retinaculum is on the top of the foot, and there's another one right here. So the definition of a retinaculum is that it's basically a ligament. It holds these tendons in place right here by attaching from bone to bone. Okay. So when sometimes you can see on certain places on our foot, you can see the tendons well, and then sometimes, like right in this area, you can see the tendons less well because they're covered by the retinaculum. So extensor hallucis is here, extensor dig is here. Okay. Again, you're contracting the muscle to find out where the tendon is and where the muscle is. Okay? Some of this you're going to have to feel where that tension is rather than simply look at it. So now we want to move on to tibialis anterior. So for tibialis anterior, the job of tibialis anterior is dorsiflexion, so pulling the foot up and then turning it in like this. Kelsey's a runner, and if I didn't know that already about her, I would certainly guess that because I can see the size of her anterior tibialis tendon right here. It is definitely big and strong. Okay? It attaches, if you remember looking at the video, on this first cuneiform, first metatarsal right here. So the attachment of it is right here. And the tendon then, when she goes into plantar flexion and inversion, is really easy. I don't even have to give her any resistance. I can see that the tendon is right here. So that structure is part of our foot palpation. The muscle belly is part of our ankle palpation. So if you're moving from medial to lateral on the top of the foot, anterior tibialis tendon, relax your foot. So the anterior tibialis is here. Extensor hallucis is here, and extensor digitorum is over here. Okay. On the lateral aspect, there's a tendon that we want to palpate, and it is the Peroneus, Longus, and Brevis tendon. It's called the common peroneal tendon. And what those muscles do is those muscles go into, they move the ankle into plantar flexion, and they move the foot into eversion. So look at that. You can see it sticking out right there, right? And it goes right across the the lateral malleolus right there. So here is her Peroneus, or her common peroneal tendon, goes around the malleolus, okay? And for Peroneus brevis, that portion of the tendon attaches right there on the base of the fifth. So there's that tendon, okay? Now, for ease of everybody being able to see, I'll switch feet. So keep in mind, Peroneus tertius is over here, anterior tib is over here. Don't confuse it with posterior tib. So posterior tibialis, if you were able to watch the video and look at the PowerPoints, is a deep posterior compartment muscle, okay, posterior tibialis. And because it's deep and it's in the posterior compartment back here, it's covered up by the gastrocnemius and the soleus, and there really isn't a good palpable portion of tibialis posterior except right behind the medial malleolus, okay? So for tibialis posterior, the job of tibialis posterior is plantar flexion and inversion, and when I have Kelsey do that, okay, I am going to give you some resistance on this one. All right, look at that. Okay, so that stands out really well. That is her tibialis posterior tendon right there. Cool? Okay. Some other structures in that area that are not on your list are the tendons. This is an area that we refer to as Tom, Dick, and Harry. So it's the tibialis posterior tendon, the flexor digitorum tendon, and the flexor hallucis tendon. So the muscles that curl your toes, curl them under, okay, that's flexion right there, and then just do the opposite real quick, so that's extension. The muscles that curl your toes are flexor hallucis and flexor digitorum. The tendons are on the bottom of the foot just the same as the extensors are, but you can't palpate them. The only place that you could palpate them is right behind, it's a little bit above and behind the medial malleolus, and it's right in this area right here. Okay, so tibialis posterior, flexor digitorum longus, flexor hallucis longus, and there's a posterior tibial artery right there. Okay, so that's an important landmark for us. Speaking of arteries, on the top of the foot, in between the first and second metatarsal, okay, right about here, I felt one really good pulse and then it went away. This is your dorsal pedal artery. So in between the first and second metatarsals, and there it is right there. It's not as strong as the radial artery or the carotid artery, so you may have a little bit of trouble finding it. She has a very healthy pulse right there. Okay. Two structures that I know I forgot on the bony landmarks, and I'll go over them right now, were the talar dome and the talar head. So for the talar dome, what I recommend is that put the person in sort of a neutral position here and put your thumb in between what we now know as anterior tibialis tendon and extensor dig, so right here. And my thumb actually sinks in a little bit, but as I move her into plantar flexion, I can't get my thumb in there anymore, and that's because the talar dome has come forward from underneath the medial malleolus, from underneath the tibia. So here's your dome of the talus. Then to find the head of the talus, here's the navicular tube here and the medial malleolus here, and the head of the talus is going to be right in here. So those are two landmarks that I also wanted to make sure to mention. Okay, have I forgotten anything about soft tissue here? Plantar fascia. So the plantar fascia on the bottom of your foot, when you're palpating that, it attaches on the metatarsal heads. Okay, so I know some of you guys cannot see that, but you're palpating it from the metatarsal heads down the bottom of the foot and to that medial calcaneal